So welcome to the third lecture of the Mulligan approach, the Mulligan concepts, and the evolutionary eclectic approach. So we'll talk about the evolutionary eclectic approach, meaning that the Mulligan concept builds on the work of the predecessors of other fields of manual therapy, such as Frederick Keltenborn, Jeffrey Maitland, Robert McKenzie, and others. The Mulligan concept will take certain concepts from the predecessors and integrate them into the Mulligan concept. So we're starting with Frederick Keltenborn. So Frederick Keltenborn is one of the main mentors of Brian Mulligan, and his approach, the Keltenborn approach, will have a strong biomechanical analysis of joints. It will talk about physiological motion as well as accessory motion. There's also the dynamic treatment plane. We need to know as to, for every synovial joint, there's usually a convex surface and then a concave facet, and the convex and concave relationship of the synovial joint will dictate as to how the joint rolls, spins, or glides. And for the Mulligan concept, the glide needs to be parallel to the concave surface to maximize accessory motion of the immobilized joint. The next one will be Jeffrey Maitland, and Jeffrey Maitland talks about the irritability level. Is the patient a pain dominant case or a stiffness dominant patient? And the irritability level will dictate how aggressive you can go with the patient. So if the patient is at rest, is very irritable, and then when you move a little bit and the pain just spikes up, and you may not go as far as you would like to in other cases. Jeffrey Maitland also codifies assessments, as well as talks about how to prove value with assessment, intervention, and then reassessment. For Robert McKenzie tells us that we need to assess the repeated motion. If the motion is repeated and the pain centralizes, meaning that the distal symptoms are reduced, or like the proximal symptoms are reduced and abolished, it means it's an improvement, and that's the direction of preference. And so, as the treatment direction will just follow the direction of preference, where the direction of the improvement will be the intervention direction. And so with the evolutionary eclectic approach, Mulligan concept builds on the work of the predecessors, and so that's the concept of the manual therapy and Mulligan approach, and the evolutionary eclectic approach here. Thank you. Again, my name is Chris, and I'm a physiotherapy student. Hope that you can learn something from this lecture. See you next time.